Welcome all. Welcome to this M Excellence Tasseographer tale. And there is a very specific reason for creating this video today, because got one message from one of the persons who are going to give the examination, and they have said in the admit card then you need to have your pictures in which you have to paste the name and the date, which have not been initially mentioned in the admit card itself, but it have been given in the prospectus. So you should be aware of it. If you have not done it or haven't seen it, to stay in the safe and side, it is better to do that before going to the examination center itself. And someone have asked about some important topic they can see. So we have already given the subject specific suggestion almost a month back, but giving suggestion on ophthalmology and only giving the topics which I feel is very going to be very important. Number one, and these all are based on the recent trends, spectacle power. How to do that? You should be very much clear idea about it. There is only spherical, only cylindrical, both, and on basis of that, what should be the correction? Number two, hypertensive retinopathy. In hypertensive retinopathy, you have to be aware of Sallu sign, bonnet sign, and gun sign. Also, copper wiring and silver wiring and the stages of that. Again, third is diabetic retinopathy is always going to remain one of the important post topic. 4. You can never rule out lens. So most common cataract, typical cataract in different conditions like diabetes, in the trauma, in Wilson disease, you have to be aware of them. Also most common congenital cataract and most common congenital cataract with the visual difficulty. These things you have to be very much aware of. And then after the treatment procedure, these are going to be very important. Now, if we after lens there's vitreous, and we can never rule out vitreous hemorrhage. The characteristic finding. Then comes the retina, and this is going to remain one of the most important subject. Just like every ophthalmologist wants to be a retina specialist, so retinitis pigmentosa, retinal detachment and different types of retinal detachment and their classical finding. Then retinal hole, and then after we have to go for the optic nerve. In optic nerve, we have to know the difference between papilledema and optic neuritis. These are questions used to be asked in the 3rd MB, but from this easily question can come. And from optic neuritis we have to know the difference with the retrobulbar neuritis, how to differentiate them. And also the graphs of EOG and ERG, A, B, C, everything. This can be your visual based question. Then in the tumor you can never rule out two things. One is retinoblastoma, and it can give rise to one pathology question also, the rosette one, retinoblastoma, and its treatment options, how to treat them. Of late, neuro-ophthalmology is going to be very important topic. Neuro-ophthalmology. So squint you can never rule out. And classification of squint. At the same point of time, Eoc muscles. In retina, forgot to mention two more important topic. One is central serous retinopathy, with their OCT findings, the classical pictures that being visible there, you most probably are aware of it, and CMV. Sorry, cystoid papillary edema, CME, and the classical findings with the OCT images. These are probable questions that can come up. In the anterior chamber, though not as important as the posterior chamber, but if you expect them to be little lenient, it can come from the pterygium. Again, visual based question, typical question can different question from pterygium. We can actually create right now 10 questions. So pterygium, you can ask, many questions can be asked from that. Also vernal conjunctivitis, vernal keratoconjunctivitis, and classical finding, that can be a pictorial questions. From lictennular, they can give a pictorial question, but vernal is more important, and trachoma. Trachoma is always going to be very important. In fundus, they can easily ask you about the rot spot. Fundus, they can ask you about the rot spot. What is the specific finding how that you can diagnose a rot spot? And also CRVO and CRAO. Central retinal vein and arterial obstruction. With classical findings, and that ophthalmoscopic images, that fundus images, can be a pictorial question. And also vitamin A dosage for the community, from the community medicine ophthalmology part. So these are the questions expected, these are the high, that is why I have just told you about the topics which can be an important question that can come up from that. And also the instruments like Snellen chart and many things that we have already made public. They can jolly well give one instrument. And the purpose of putting this suggestion, so you can actually supposed to get around 10 to 12 questions from ophthalmology out of 300. So you can figure it out after giving your examination how many questions actually came from the topic that we have already mentioned to in front of you. You have been trained most probably by the best of the teachers, so you can see yourself that how many topics are coming from the suggestion that were uploaded for the ophthalmology only. And we have already made the 20 topics, 20 subjects suggestion, and that have been given to the people who have supported M Excellence all through. Hope those suggestions also come through very strongly, and hopefully we are going to have a meeting in the days to come in this year, and wish you all the best. Do well, and if you haven't done actually taken the photograph with the date and name pasted in it, it's better that you do it to spare yourself from any hassles in the examination center. Do that then. Hope you do extremely well, exceedingly well. You have really done a tremendous preparatory work, and this whole year hard work is going to be end, and wish you very best. Almost 1.7 to 1.8 lakh people are going to give the examination this year, and the coveted seats are going to be over from 5 to 10k range. So it's a very tough competition, and all the best to those who are going to do exceedingly well. And our updates will continue this year also, and let us know out of all the topic that we have uploaded, how many actually came, and you found these topics are, if you have seen these topics before going to the examination itself, it's actually helped you. Thank you.